Hi, and welcome to Community Voices, everybody. I'm AnnaMarie Jones. Mainline Television Network is teaming with two of our local state representatives, Jennifer O'Mara and Greg Vitali, to bring to you the latest local government information on best practices for mitigating COVID-19. This pandemic we are facing is truly humbling and does not discriminate. COVID-19 is shining a light on the very truth that no matter our place in the world, our culture, color of our skin, religion, socioeconomic status, physical or mental differences, we are all human beings who can terribly be affected by COVID-19 if we don't take seriously the guidelines put in place to keep us safe. Jennifer and Greg, thank you so much for being here today with us.
Well, thanks for hosting.
Yeah, and first of all, can you talk to us about who you cover? So you're our state representative, so what is your district?
Right, so I'm in the 166th district, and that includes about half of Radnor. I kind of go from the Garrett Hill section east up until about North Wayne Avenue. So I have about half of Radnor. In addition to that, I have most of Haverford Township and a little bit of Lower Merion.
Okay, great. And Jennifer, remind us what your district is.
Thank you. So I represent the 165th district. So my district includes the rest of Radnor Township that's not in Greg's district. And in addition, I have Springfield Township, Marple Township, and Morton Borough.
Okay, great. And you guys are here today, and we aren't really coming into the studio because we're trying to adhere to all the rules, but we thought it was important to get together to team and talk about the crisis that we're facing together as a nation, as a world, really. I'm sure that you're fielding a lot of calls from constituents, so would you like to go first, Jennifer, and tell us some of the top questions you have and concerns that you're hearing from constituents?
Sure, yeah, thank you. And my staff is not in the office, but we're available virtually, so we're taking calls, fielding emails, and taking social media requests from 9 to 5 and much later than that because I'm on it. The biggest thing that people want to know is what the state is doing, what the county is doing. I know we just announced today, March 19th, I'm sorry, that there's going to be a partnership between Chester County and Delaware County Health Departments. That has been one of our top questions. People are also asking about safety precautions if they have to go to the doctor. What do they do if they have symptoms? How can they get tested? What happens if their license is expiring? So I just put together a guide that people can find on my social media that is basically the most frequently asked questions, and you can follow me on all my platforms at Rep O'Mara. And we're trying to keep that up to date as much as possible so people can start there before calling us.
Okay, great. And Greg, how about you?
Okay, yeah, so our district office, we actually have a person on the inside. We're not taking walk-in clients. We have our other two staffers working remotely. And they are handling some of the normal traffic that we get, but also a lot of the COVID-related questions, what's open, what's closed, what else do I do? But I think, one thing I'm trying to do, and I'm sure Jen is too, is we're conveyors of information. I've never seen a higher volume of information coming at us. It's like drinking water from a fire hose, as they say. And I think we have to sort of filter that out a little bit and get it to constituents so they know what's happening. And then, like on the legislative side, me and Jen were in Harrisburg on Monday. And, so there is a whole host of bills that have been proposed specifically for this, things relating to schools, things relating to unemployed workers, things relating to businesses, things relating to care centers. So we have sort of like a whole host of potential pieces of legislation we can and should deal with relating to this. And we were just chatting beforehand. We may be in session this upcoming Monday, some of us remotely, some of us in person, to start to deal with this COVID-related legislation.
Okay, and what is the legislation as it pertains to schools and businesses and care centers, as you've mentioned, that you think you might be voting on or talking about when you are in session?
Well, we just got a letter from you may have gotten them too. Yeah, I mean, so some basic stuff like like a waiver from the 180-day school year. More what they call classroom flexibility, the ability to sort of teach students without actually them physically coming into class. Things like dispensations relating to the Keystone exam, just one-year waivers relating to things like teacher certifications, all the things, that are in our school code but are going to be messed up by the fact that we are not going to be here. The schools aren't going to be in session. They're going to miss at least 2 weeks, probably. A number of weeks other. So that's the school piece, plus a lot of other things I'm missing.
Right.
There's a couple of bills related to higher ed as well, specifically dealing with student loan payments, potentially halting them or halting interest, which is something the federal government's also talking about doing. But a lot of it is still being written, and that's why this week we went up there and passed a rule change that will allow us to vote remotely. But I know that the LRB, the Legislative Research Bureau, who writes legislation, is actively getting this ready and reviewing what federal changes have been implemented to see what it is required on the state side in terms of interpreting those federal changes, especially when it comes to Medicaid dollars. So we're sort of still waiting for what the agenda is going to be, and we will know more as the day continues to unfold.
So if we are interested in knowing how everything's going to change school-wise, then we would just go to pahouse.com and see how you're voting and what the legislation is, or how does that work?
I would actually suggest anyone curious about the education side of things to visit the Pennsylvania Department of Education website, which you can also find in the resource guide I mentioned earlier, or on all of our websites. There's links that lead you there. But there is a frequently asked question, a guidance page that the Secretary of Education and his staff are updating daily. Because a lot of this stuff that's happening doesn't necessarily require legislative action because we're under a declaration of emergency by the state. So the governor's administration has more flexibility. So for the most up-to-date information, visit the Pennsylvania Department of Ed website.
Okay. Yeah, and I would just add, and I think Jen might agree with this, is, email communication with our district offices is a good way to do it. So if you're a constituent of mine, Greg at gregvitali.com, GREG@GREGVITALI.com, and we can answer specific questions. But the nature of this, and it's one of the most unusual situations I've ever been in, if not the most legislatively, is how quickly the information changes. Yeah. It's like if you
so fluid.
Take an hour to do something else and come back. It's like everything is changed. So we're keeping track of the changes as best we can. So I would say the first thing to do is just email, and then or just give us a phone call, and we can figure out what's the latest on any of the multiplicity of issues out there that are being affected by COVID-19.
What are the top concerns you're hearing when people are calling in or emailing you?
Well, for us, one of the top concerns we've been hearing is, what do you do if you have symptoms, and how do you contact the Department of Health, because we haven't had one at the county level, so we've been sending people to the state. And people are also concerned about following the guidelines, and they're driving around and they're seeing that some people are not following those guidelines, and they're wondering what enforcement exists. At this time, the governor is still urging people to follow these guidelines voluntarily, and so I'm also urging people to social distance, stay at home, try to think about what the risk versus reward is if you have to go out. Absolutely go to an essential doctor's appointment if you're still scheduled, or to the grocery store or pharmacy or gas station if you need something, but try to limit the unnecessary trips, because this is really going to take all of us doing our part to mitigate the spread.
Absolutely, and social distancing really is key. We're doing people watching can't see that we're actually doing it right now, that we're staying the appropriate distance apart. So that really is important to practice that in every circumstance.
Yeah.
What else are you hearing?
No, I think, yeah, you know, I'm getting sort of the same sort of questions, you know, just people concerned, or, you know, where's the testing, where are the test kits, is this open, is this closed, can I do this, can't do that, sort of things like that. But then the other things, you know, extensions, you know, my driver's license is going to expire, how does that affect things, or, you know, things, anything that, you know, things along those lines.
Let's start with PennDOT. What is PennDOT doing for licenses expiring or registration?
PennDOT announced as of March 17th, all of their photo ID centers are going to be closed across the state. I believe now everything's closed across the state.
Right.
So what they have announced is that anything that was set to expire during this time is automatically extended until April 30th, 2020. So that includes driver's license, photo IDs, handicap placards. The government has also requested an extension on Real ID because most people know we're getting ready for that. So we're waiting to hear what the federal government says about extending the deadline. PennDOT has also closed many of their rest stop facilities, which was maybe an oversight when we're thinking about the truck drivers and other essential personnel that have to move. There were a lot of safety questions that rose right away. So as of today, some of them are open again, and there are different guidelines. So for the most up-to-date information, I do encourage people to go to PennDOT's website, because all the press releases that we're receiving are also being posted there. And people can absolutely call us and ask questions, but everything is getting updated at a very timely manner on the agency website.
And Greg, maybe you can address this. Jen mentioned that the county does not have a health department, so we are having to lean on the state. Is that something that will be addressed in your legislative sessions?
I think Jen just mentioned at the beginning, you know, something significant in that just either today or yesterday, the state approved the allowance of the Chester County Health Department to take over the corona-related issues, you know, with regard to our health department. You know, the testing, the tracking, things like that. So, you know, this has, you know, it's ironic because, you know, the county council just turned Democratic, just got the Democratic majority in the last election, with all 5 county council people being Democratic, and the campaign from Democrats for many years has been, we want a county health department, and I think we're seeing the need for that now. Regrettably, you know, it's coming a little too late for probably, you know, the one thing that probably needs a health department more than anything else. But it is ironic, but you know, that is what's happening locally. Chester County Health Department's kind of taking over the coronavirus-related activities of Delaware County.
Right. Well, I think that COVID is shining a light on some of our weaknesses, and this is a reset for us.
Right.
In ways.
Yeah.
And also, you know, something that I worry about as I go on walks around town to try to keep my sanity, I see a lot of shops closing, and not for good, but closing because they have to adhere to the guidelines. My concern is, will they have to close for good at some point if they're not keeping up with revenue? Are there going to be any subsidies put in place to help these businesses so that we can see that they're open? I mean, they are a fabric of our community.
Yeah, absolutely. I know the very first immediate need that we've been trying to address is unemployment, because many of the people who work in these businesses are now left without an income. Pennsylvania has made some adjustments, so the 2-week waiting period in the unemployment process has been eliminated, and some are so the other requirements. So we encourage everyone to try to apply, because it's a case-by-case basis, and let the state determine whether or not you qualify for unemployment. Unfortunately, that doesn't help the small business owners. So as of yesterday, the governor's administration has released more funding that can be used for loans, small business loans, low interest rates. So we also are encouraging small business owners to apply for those. That's totally separate from the federal government relief that we're going to see. I know last night the president signed a bill, the first package that Congress has released, and there's going to be more. So there are a few resources people can look up. Again, I know I'm directing a lot of people online, but we're home, so we have time. The department, DCED, the Department of Community and Economic Development in Pennsylvania, has a great resource that both of our offices can direct you to. And then the Small Business Administration has a great, that's the federal side, has a great website with resources that Congresswoman Scanlon's staff can help you with. So if you're having trouble navigating any of those resources, definitely email us or give us a call, because our staff can help you get that information right away.
Right, very good. Do you have anything to add to that?
Just to sort of just add a little bit of detail to what Jen was saying. With regard to unemployment compensation, they're eliminating that requirement that you be searching for work, because you don't want to be doing that in this thing. And I know that just in sort of glancing at the legislation that's proposed, going to what you mentioned about the small business loans, I think someone, maybe Senator Killian, someone has a bill out there that would just have zero interest loans for small businesses. So there's very much on the business side of things, this awareness of both the displaced workers, and rules need to be changed to help them, and the small business people, where they need assistance to sort of, as you say, not close permanently.
And one other thing to mention is the Public Utilities Commission has announced that they're suspending any emergency shutoffs, and they're not adding any late fees. So if anyone is struggling, at least with our utilities side of things, there are some adjustments being made to help if you are struggling making those payments. And it extends with companies like AT&T and Verizon and Sprint. A lot of companies have announced that they're helping in those ways.
Great, so someone would just have to contact their service provider.
Yes.
Okay.
And we have liaisons in our office that deal with PICO and whoever, Aqua PA and whoever, to just, even in good times when there's difficulties paying, we have liaisons if there's extenuating circumstances, or even these circumstances which are extenuating. We can sort of be a liaison on an individual basis. So
That's
just,
good to know.
I think you get better service. You'll probably agree, if you work through a legislator's office in dealing with these utilities than if you try to go it yourself.
Right.
Yeah, and I definitely agree. And I know we're not the only two working to help constituents in this way. I have Senator Tim Carney that covers some of my district, plus Senator Dalen Leach. I think you have Dalen and
almost entirely.
Yeah, so those offices are there to provide support in addition to the Congresswoman's office. So if there's a lot of people out there ready to help.
Okay, good to know. And something that I'm concerned about, being home with children, trying to keep their energy focused in the right direction, going out for walks. In terms of parks and recreation, are parks open for the utilization of the public, or?
So some parks are not controlled by the state, so you'll have to consult your local township for some of those answers if it's a township park. But state parks have been announced that the facilities are closed at state parks. So the bathrooms, the offices, any events that were scheduled have been canceled. But the actual park is open for recreational activity that can be enjoyed away from people. So hiking, lakes are open if you have a boat. But again, if you need to rent, that's not going to be an option. So we are encouraging anyone who visits the state parks to still practice the same social distancing practices at the parks.
Right. Anything to add about
Not
parks
really,
and
but
recreation?
as I am out and about in the neighborhoods, I just see a lot of people walking, much more so than normal, and it's
We're
kind of
doing
nice.
a lot of walking.
And if anything, if there are any positives that will come out of this, it's that we are sort of forcing people to change their pattern of conduct. Just figure out stuff to do that doesn't involve maybe going to their normal gym or going to their normal bar, so that could be a positive. And I also think this idea that, the more you think about this, the more you realize that we're all in it together. And it sounds like a cliche, but it's true. Even a healthy person who doesn't fear getting the virus themselves has to realize they're a carrier too. And the only way, I mean, it's just this sort of commonality. And then you can sort of apply this to other things like climate change and so forth. I mean, we're all in it together, and your conduct affects everybody, and everyone has to cooperate to beat this thing. And
Right.
that's sort of a lesson
So
I hope
basically,
people take.
we are loving each other by staying away from each other.
Yes.
Yeah.
And I think that that's important. However, I do worry about elderly, so
Right.
grandparents that are
Right.
used to being with their families.
Yeah.
We're
Right.
socially distancing from,
Yeah.
my mom and mother-in-law, and I worry about their mental health.
Yeah.
What do you have to say to that?
So I'm glad you brought that up. I'm actually working on putting something out right now about mental health resources. So just because we're socially distancing doesn't mean we have to isolate, in that technology is a wonderful thing. I encourage you to pick up the phone and call your family, check in with your grandparents, check in with your kids if they don't live with you at this time. Use FaceTime. I'm telling my staff we're going to do virtual check-ins with cameras, not just calling, because it allows us to see one another. We've been sending each other video, like pictures from our working at home desks, to try to make it more fun. And there are resources still available. So if anyone wants someone to talk to or is struggling, you can always text 741-741. It's a Pennsylvania resource. You can also look up, I'm going to be sharing it, I'm sure Greg can put it out too. There's a lot of mental health resources available online. So I'm just trying to remind everyone to try to make the most of this. And I've seen a lot of parents commenting about their kids are more anxious. And so I just want to remind everyone, and it's sort of what we're modeling now too, is you set the tone, right? So try not to let your kids see your stress. Turn the news off. There's no reason to watch it 24/7. Get off Facebook. Try to, connect in the moment with your family and enjoy this time that you have to be home, because it's very rare in a lot of cases.
It is. Like I keep saying, the silver lining is that we are resetting.
Yeah.
And spending more time together. And you mentioned that too, Greg. Playing a lot of games and going on the walks. And, my son, he's 7, he had his first virtual play date.
Nice.
He did a FaceTime play date for half an hour. We set our clocks. We got our phone back after the half an hour. Both moms got the phone back. But the kids were so happy for it, to be able to spend time with each other and play, show each other their toys.
Yeah. And
Online.
one thing I used to do before I got elected, I was really big into writing, and I'm encouraging people to write now and journal and keep track of what you're doing each day. It's going to be interesting to look back on one day, but it also gives you an opportunity to de-stress and practice mindfulness and put yourself in the moment a little bit.
Yeah. Would you like to add anything, Greg?
Well,
What are you doing to keep yourself?
Greg's running.
That's a good question. Yeah, I actually ran with my a little subgroup of a run club last night, and I've assembled my old high school weights in my basement to work out, since LA Fitness is no longer there, and biking. But seriously, I mean the issue at the beginning of this sort of conversation string was seniors, and how senior centers are kind of locked down, and that's just so important. I have a friend who was the director of senior center out in Western Delaware County. It's just like, that's Seattle, where all the deaths came from there. That they were the beginning of the deaths, because they I mean, what might be sort of normal for us, or something we can survive, they simply can't, and you have to sort of respect the very tough barriers they have set up, because if that virus starts to work through a local center, you're going to see significant deaths, and that's what we want to avoid.
Okay. Is there anything else you'd like to add before we wrap up our time together?
Well, going back to seniors, definitely make sure if you have neighbors, that you're checking in on them, especially if you know they're by themselves. And keep, for seniors who are worried about shopping, grocery stores are starting to implement hours for senior citizens. So starting today, all giant stores are letting seniors shop from 6 a.m. to 7 a.m. And I know a couple other chains have adopted things like that. So, and if you need help, there are still resources there. Meals on Wheels is still providing food, and Phil Abundance can provide food. So if anyone of any age is struggling with food scarcity during this time, reach out to us, reach out to the resources that are there, because there are still ways that we can get you support.
And schools also have programs for food insufficiency.
Many schools do, yes.
Okay, great. Good to know. Well, I want to thank you both for coming on during this very crucial time in our history. I can't thank you enough
for
this
the
vital
opportunity.
Information. And I want to repeat some of those websites that you shared. So going to healthpa.gov is a good place to go. If you want to reach out to Jennifer or Greg, you can go to pahouse.com, O'Mara, and then pahouse.com/Vitali, so / for both. And another great resource is 1-877-PA Health. If you have any questions pertaining to COVID-19, you can go to 1-877-PA Health. Another great website to access is governorpa.gov. And can you explain quickly, Jennifer, before we...
Yeah, so each day the governor and the Department of Health secretary, sometimes one of them, provides a daily press conference update that you can view live from the governor's website, governor.pa.gov. And they also have added a new resource guide that's a one-stop shop for individuals, businesses, centers, healthcare providers, where you can find information that you can access from the governor's website as well.
Wonderful. Thanks again, guys, for being here. And thank you all for tuning in to Community Voices. Please stay safe. Please follow the guidelines. We will get through this together. And have a great day.